Welcome back, everyone, for the part 2 of this lecture. Over here, we're going to just finish up a little bit of the newborn, mostly the newborn care, and then we're going to move on to the infant, which is 1 month to 1 year of age. To help organize this lecture, I added the content slide here. You can see we're first going to go over parental education, the basic infant care, and these are going to be items that you would teach someone upon discharge with their newborn. Then we're going to go over the infant growth and development, which is going to include the gross motor, fine motor, communication, psychosocial, social development of the newborn and infant. Then we're going to go over immunizations, and we're just going to focus on birth to 1 year immunizations for now. Then after we can imply some of this knowledge with the safety and injury prevention based on developmental milestones. And then last, we're going to talk about infant nutrition. So this slide, as you can see, includes a lot of information that the parents need to be independent with when taking home their newborn. And this leads on to infant's care as well. So head support is just that. You want to teach them that they need to support the head when transferring the infant. Positions, both positions that they should sleep in, so placing the infant back to go to sleep, and then also positions of breastfeeding. Wrapping, so this has to do with preventing the heat loss. You want to make sure they know how to swaddle and bundle the baby. How to use a bulb syringe. You're going to want to make sure they know how to clear out any secretions from the nose. This way the infant, because they don't have a fully developed respiratory system, which we'll go into soon, they're not going to be able to clear their secretions out. So this is a safety issue. How to take a temperature, whether it's under the arm or rectal. The urine and stool output, which we covered earlier in the last lecture. You want to make sure the infant's having at least 6 to 8 wet diapers and frequent stooling based on the diet, so either the breastfed or formula fed. Skin care, just appropriate lotions that might be needed, and not to pick at the little pearls that they might have. Circumcision care, so you want to make sure they don't have complications. There should only be a few drops of blood with the first diaper change, and then that's it. Another complication is failure to urinate that the parents need to be aware of, and then signs of infection, which could be a fever or even a low temperature on the other end, and then any purulent, foul-smelling drainage. Cord care, so you want to make sure that they keep the cord dry. They don't want to put any lotions on the cord. They also don't want to submerge the cord in water. So for the first time, until the cord falls off, the first few weeks here, it's going to be sponge baths. And then once the cord is off and healed, they can go into full bathing tub baths. You want to teach them about the behaviors, so making sure they know the different wake-sleep cycles. They don't want to be trying to breastfeed the infant when they're in a deep sleep. You want to make sure they're awake, alert, and active before that. And then socialization, picking up on the cues, the smiling, and then as it goes on, we'll talk about on this lecture about the different socialization milestones. Growth and development of the infant. So again, infant is age 1 month to 1 year. And this is a period of rapid growth and development. Your text, it highlights the growth and development during this age range, and it goes further into detail, but I'm just going to hit the high notes on this here. Growth is an excellent indicator of the overall health during infancy. This is why we measure it and care about it so much. It's important to note that the neonate was going to average about a 10% weight loss of their total weight shortly after birth. But they should regain this weight about 2 weeks of age and continue to incline from there on. Head circumference is going to be monitored and documented, and this should increase in each month after for the first year period. And then the posterior fontanelle, it usually closes about 2 to 3 months, and the anterior fontanelle will remain open till about age 18 months. And while there's rapid growth and development, it's really important to pay attention that the respiratory system, immune system, and renal systems are all immature in the infant. This immaturity increases their risk for respiratory infections, just generalized infections, and fluid and electrolyte imbalances. These are growth charts that are formed by the CDC, and they are typically used in every pediatrician office. And what this does is it tracks the growth and development, and it also shows the percentage of where they are. So you'll see all the different lines on here, and you'll see the 5, 10, 15, 20, and all the way up to 100, or I think it goes to 90. And this shows where the child, the infant, lies in regards to the other population. So it's similar to your ATI exam, where it's not a score 0 to 100 based on what is correct, but it's based on the population where they fall in it. So if they're at 10, they are 10% of the population is below where they are in either height or weight, and then 90% is above them in their height and weight. For gross motor development, we're talking about the large muscles here. And a lot of the information, not just your text, but don't forget to be looking at the ATI that was given to you for this course, because this also has a lot of information that's useful. And it's pretty clear. They have a nice table on there as well that explains all of this. So for the gross motor, at 1 month of age, there's really not much gross motor. It's mostly all the primitive reflexes, so the moro, the tonic neck reflex, the rooting, and they're all present and primary source of the gross motor right now. By 2 to 3 months of age, this is when you're going to start to see the infant pick their head up when they're laying down on their belly in the prone position. They're going to start to be able to pick it up briefly. They're still going to have some slight head lag, but not as much as the infant at 1 month. At 4 months, you're going to start to see them rolling from their back to their side, and then you're also going to notice that the primitive reflexes that were prominent at birth are now going to start disappearing between age 3 to 4 months. At 5 months, again, more rolling. This time it's from their front to their back. And they're also going to start rocking back and forth when they're on their knees. And this is a precursor to the creeping and crawling. At 6 months, they're going to start to roll from their back to their front. So you'll hear a lot of parents say, I still place them back on their back to go to sleep, but then I check on them and then they're on their stomach and they get really worried. But you can also remind the parents that they have the ability to roll from the front to the back that they developed usually around age 5 months. You'll also see them briefly sitting supported. You'll see the Bumco chairs being used at this age. And for safety, you want to make sure that those are never up on a high surface. They're always down on the floor. 7 months, they start to bear weight on their feet. So you'll see them bouncing around. This is also a time where they use the cruising chairs. Sometimes they're like a little race car shape chairs, and there is safety concern, especially if there's stairs in the house. You wouldn't want them cruising around on this and going down a flight of stairs. At age 8 months, they sit unsupported, so making sure that the area around them is soft still in case they do topple over. At 9 months, they start to pull themselves up on their hands and knees, and this is where creeping starts. And creeping is a precursor to crawling. If you're not sure what that looks like, you can watch the video clip I included here. It's basically crawling with the belly still on the floor. 11 months, you'll see cruising, and again, I included a video clip. Cruising is where they're learning to walk, but they're holding on to the furniture around them, and they don't really let go of this until they get to about 12 months when they start to learn how to walk alone. And they'll also sit down from the standing position. So sometimes you'll see the parents walking with them holding hands, and then they'll let go. And the immediate reaction is to sit down instead of walking on their own. So now we're going to move on to the fine motor development. And the fine motor, we're going to focus for the infant on the hand muscles. So for the newborn, they have a grasp reflex, and there's very little fine motor control. It's all basically, if you put your hand in the infant's palm, they're going to grab onto it without much intent. At 2 months of age, this is when they're going to start to open their hands every once in a while, and the grasp reflex starts to fade. At 3 months, the infant will hold objects that are placed in their hand, and their hands are usually kept more loosely open than prior. Around 4 to 5 months, they're going to grasp objects with both hands, and they're going to use the palmar grasp, which I included a video here, and that again is similar where the infant will, similar to the grasp reflex, where the infant will hold on to something that's placed in their hand. 6 to 7 months of age, this is when they're going to start to be able to hold a bottle and pick up different objects with real purpose and intent. After this, 8 to 9 months, this is the pincer grasp, and this is when the infant will pick up something with a finger and thumb, and this obviously requires a lot more control of the fine motor skills. Here's a video you can click on to see that. You're also going to see at this age, they're going to start to show one hand to be dominant than the other. At 10 months, they're going to start to grasp toys such as a rattle and shake them with purpose. They're going to hold on to items readily without dropping them as easily as before. At 4 months, this is when they're going to start to place objects into a container. So this is where you'll see like the box of different shapes, and they'll be putting them in. This is a fun game for them. And then at 12 months, they start to feed themselves, and they'll turn pages in a book. And, you know, of course, in saying this with the months, every single infant is going to be different, but these are just the general timeline. And again, look in your ATI book for more information on this and a nice chart to look at. Communication development in infancy. The first form of communication for infants is going to be crying. This is their first form to communicate with anyone. And they also have a reflex too, a smile reflex. It doesn't really hold much meaning other than it's a reflex, but as time goes on, it'll start to become more voluntary. You're going to see cooing and babbling start to happen around 3 to 4 months of age, and this is when they start to experiment with different sounds, and this kind of blends into around 4 to 6 months where they do this experimentation. They're also going to have a different cry, and their caregivers will be able to pick up on whether they're tired or hungry or fussy or need a diaper change. It's usually something that only the caregivers can really pick up on. Squealing also happens where they get that happy high-pitched squeal that sometimes hurts your ears. And then around 6 to 8 months, this is when you're going to see some of the more fun things happening. They'll start to be making more sounds, more interesting sounds, and putting some sounds together. They're also going to have that lovely belly laugh. I've included a video here because even though most of you know what a belly laugh is, it's just so fun to see at this age. Next is around the 8 to 9 month period, and this is when they start to say few words. Usually mom or dad, it's usually dada, and it doesn't have much significance at first, but because of the praise they continue to practice it, and they quickly find out that it has a meaning. They're also going to understand commands, so when you tell them certain things, especially around 9 to 10, when you tell them no, because they're going to be told this a lot for safety reasons, which we're going to be getting into, they understand and comprehend these words. They're going to have a vocabulary of 2 to 3 words, again, dada, baba, things like this, around 9 to 10 months, and they're going to use them with purpose. 10 to 12 months, so they're going to be using gestures more to communicate, such as picking their hands up up towards their caregiver when they want to be picked up. A lot of families try to use sign language to communicate with their infant at this age because they're able to do this much easier than speaking words. Their vocabulary is only going to be about 3 to 5 words, so this is why it's handy for the sign language at this stage. Psychosocial development. So one of the most important features of psychosocial development during infancy is the parent-infant attachment, or the sense of belonging with one another. And attachment, a lot of people say that this begins before birth, when there's bonding between the parent and the fetus in utero. If they sing or read to their baby, or rub the baby's, the mom's belly where the baby is, this is the first form of bonding from the parents. This bonding, it is needed for survival. It needs to happen within the first month. And this process is enhanced when the infant and parents are in good health, if they have positive feeding experiences, and if they're receptive or if they receive adequate rest. And these things here, they should remind everyone of Maslow's hierarchy of need. In order for one thing to take place, a foundation needs to be there of health. We're going to move on to Erikson's theory. This is his theory of psychosocial development. And it says that in the infancy period, children develop the foundation of their personalities, and they struggle to establish a sense of basic trust rather than mistrust. So caregivers, they're going to provide basic needs, such as like emotional support and providing feedings and diaper changes in a timely manner. And this provides the infant with a sense of confidence that their needs are going to be met. And this is an early form of trust. Where on the other hand, if the caregiver ignores the cues from the infant or inadequately or haphazardly cares for the infant, then the infant has no reason to believe that their needs will be met and that their environment's not safe. And this leads to mistrust. The trust and mistrust, this continues on into early childhood and even into adulthood. The psychosocial development we just discussed kind of blends over into the social and cognitive development. In this slide, we're going to discuss primarily the separation that goes on. So separation anxiety, I'm sure most of you have heard about this. This is when the infant is protesting being away from their caregiver. You're also going to see individualization, and this is when the infant first distinguishes themselves and their primary caregiver as two separate individuals. While this is going on, object permanence is also starting to develop. Object permanence, this is the process by which the infant learns that an object still exists when it's out of view. So this is the peekaboo. So when you're playing peekaboo, you're going to cover your face, and that infant during this, right before the stage, doesn't realize that you're still there. So when you remove your hands and you have your smiling face, they get very excited that you're there. This stage starts at around 7 months of age, and it continues to develop until about 10 months of age. I included a video here just so you guys can see exactly what this entails. Then there's reactive attachment disorder. And this is going to occur if there's maladaptive or absent of attachment between the infant and the primary caregiver. And this disorder, just like the mistrust we discussed in the previous slide, this is going to continue through childhood and into adulthood. So remember that earlier in this lecture, I stated that the infant's immune system is still immature. And for this reason, I cannot emphasize enough how important immunizations are. See, there's going to be a debate that some parents are going to say, I breastfeed, or, they have my immunity, so they don't need immunizations. And I'm going to explain what this means. So term neonates are protected from certain infections by transplacental passive immunity from their mothers. Breastfed infants, they're also going to receive additional immunoglobulins against many types of various bacteria, which are effective for only the first 3 months of life. Passive immunity does not cover all diseases. It does not cover all infections. And these infections and diseases can be devastating towards the infant. Immunizations are going to offer protections that these infants need. And as a nurse, it's going to be your role to promote health and to prevent preventable diseases related to immunizations, and also to provide education to parents about the CDC recommendations on the immunization schedule. We're going to go over the exact immunizations and their schedule on next lecture, but I just wanted to put this up here so you can see the birth to first 12 months, this infancy, how many immunizations they are hoped to receive. Infant nutrition. Because infancy is a period of very rapid growth and development, the nutritional needs are of special significance. So we're going to start off with breast milk or iron fortified milk, and this is the sole nutrition for the first 6 months of life. The formula needs to be prepared and stored according to the manufacturer's instructions. It's really important that the parents don't over dilute the formula because they're not going to be getting enough nutrition, and they also don't want to do the opposite and put too much powder in the formula and over concentrate it, because then it can lead to electrolyte imbalances in the infant. Also with breast milk, La Leche is a great forum for parents to use for guidelines on breast milk, both storage and how to store and for how long as well. Weaning is going to occur between 6 to 12 months, and this is the transition from either a bottle of breast milk or formula to a cup. And once the infant's weaned, this is when juices can start to be introduced, but please note it's only 6 to 8 ounces per day. It's also important to provide education to the parents about juice choices and making sure that they're offering 100% fruit juice and not drink mixes such as like High C or Kool-Aid, Sunny D, that's another frequent one. So the nurse should also provide education to the parents to not provide them with the infant with juice before they go to bed, because it's such a high sugar concentration that it can lead to tooth decay, also called bottle mouth or bottle rot. And this is displayed on the picture here I have on your slide. So just know that teeth are going to erupt around 5 to 9 months of age, and oral care should be done during infancy, which is going to include using a wet washcloth just with water to clean the teeth. And then at around 6 months of age, the parents can use a rice grain sized amount of fluoride toothpaste. And this again is going to be done with a washcloth to clean twice daily. The readiness for solid food is very much individualized, and it shouldn't occur before 4 months of age. And the American Academy of Pediatrics actually recommends now that it starts at 6 months of age. I listed a reference from your text for you to look at on the developmental readiness for solid foods. The overall message of it is that the infant must have the gross motor control to sit up in a high chair, and the excursion reflex, which pushes food out of the mouth, that has to be gone. And you'll know it's gone when the infant will start to move food to the back of its mouth and swallow when you spoon feed the infant. There should also be a desire for the food seen by the infant. You're going to see them opening their mouth and leaning towards the food. So iron fortified cereal is typically the first solid food that's offered, and this is due to its high iron content and its low allergy risk. New foods such as vegetables and fruits, they're going to be introduced one at a time over about 5 to 7 days, and this is so you can observe for signs and symptoms of an allergic reaction. And they could include a rash or irritability, diarrhea, constipation, etc. Formula or breast milk, this is still going to be the main source of nutrition, but it's going to reduce slightly as more solid foods are introduced. And I also want to make sure you guys know that water, it's only going to be needed in very small amounts once solid foods are introduced. It's important for you to provide education to the parents that the infants still receive a majority of their fluid intake from their formula or breast milk and from their foods, their fruits and vegetables. You don't want the infant to be receiving a large amount of free water, because then that's going to, again, cause a fluid and electrolyte imbalance. While safety and injury prevention slide is the last one, it's certainly not the least important. It's absolutely maybe the most important. Basically what you need to do as the nurse is take their developmental stage and apply that information to safety and injury prevention. So aspiration of foreign objects, you're going to realize once they start picking things up and putting them in their mouth or transferring them, that risk is going to increase. So you also want to think about when the infant's eating, if they are able to hold a bottle yet or not. If they're not, you need to make sure the parents know that they shouldn't prop bottles. You want to make sure that the parents only use the age-appropriate toys, not small toys with small choking hazards. And also clothing. A lot of people forget about clothing, but you want to make sure that there's no loose buttons on any of the clothes. I can remember as a student, my professor told me about a child who was in the bathroom during preschool, and they were in there for a long time. The teacher, the preschool teacher, went and checked on the child, and they were dead. They had aspirated on a button from their clothing. Burns, you want to make sure that none of the formula, so we're talking infancy with this stuff, you want to make sure that the formula or breast milk aren't microwaved because the temperatures could be so high. You want to make sure that they're warming the bottles with hot water, like a jug of hot water, and testing it before they give it to the infant. Drownings, so of course infants should not be left unattended in baths or really around any source of water. Even the toilets are not safe. So it's important to teach parents this and to make sure that they close their doors and have the infant and toddler safety handles on their doors. Poisonings, you want to make sure that there's no exposure to lead paints. You also want to know as the nurse what areas in your community are higher for lead paint. There's a high lead paint in Schenectady, the city of Schenectady, with the older buildings and a lot of the areas around GE. Their paints are traditionally high in lead, and you want to make sure that there's no peeling of paint as well. Again, safety locks on the cabinets and chemicals. You don't want to have under the sink. You don't want them to be able to get into that. They can swallow. I've had a couple patients whose children have swallowed Drano and had severe esophageal burning and multiple injuries from that. Bodily harm. So this has to do with the infant. So you want to think again about their developmental stage. When they're starting to pull themselves up on furniture and starting to creep around, you want to make sure that that furniture is anchored so it's not going to overturn and fall on top of them. IKEA just recalled, I think it was a TV stand or a dresser because the infants were climbing up on the drawers and it was toppling over and it actually killed a couple infants. Falls, the crib mattress should be in its lowest position possible and the rails all the way up. Again, you don't want them to start to learn how to climb up, and then once they're up to the top, they will fall down. The infant car seat, so these are going to be placed, if they're not in the car, a lot of people will keep the infant in the car seat when they're doing errands or going around. You want to make sure that that is not placed on top of a table, but rather on the ground or floor. This just prevents if they happen to get knocked off the table, then they're going to go face first. The safety gates, you're going to want to assess your family to see if they have stairs in their house and then provide education on having safety gates both at the bottom and at the top of the stairs. Motor vehicle injuries. So infants and toddlers, so first infants need to be in a proper infant car seat, and sometimes it's like an infant toddler convertible, and that's okay as long as it meets the recommendations of the manufacturer. But you always want it to be a rear facing car seat until age 2, or whatever the height recommendations of the manufacturer are, and you want the seat to be in the back seat, not in the front where there are airbags. Suffocation. So crib mobiles and gyms. So again, thinking about developmental stage, they should be removed around 4 to 5 months of age because they're not meant to be played with. They're just meant for the young infant to look at for stimulation. No pillows or toys in the crib because that could obviously suffocate. And then make sure that you educate your parents on placing their infant back to sleep to reduce the frequency and the risk of SIDS. This concludes the infant lecture. It's the end for both the newborn and infant, so congratulations, you did it. If you guys have questions, feel free to email me. That's usually the best way to get a hold of me, or ask me during class, either before, after, or during. And if you heard my little ones in the background during this lecture, I do apologize. Today was a snow day. Yay! I look forward to seeing you all in class.